My name is Luis de Zengotita. I am the Executive Director of the University of St. Thomas Center for Wellbeing, and today we're going to be talking about student and health and well-being at the University of St. Thomas. So I just wanted to start the presentation talking about what our wellness philosophy is, what we believe well-being is, and how we support that here for students at the University of St. Thomas. For us, well-being is a state of mental and physical health, wholeness and contentment, feeling socially connected and purposeful, and that it's a key to thriving academically and living well. We really believe that the whole person needs to be well for someone to succeed, and we're focused on helping students thrive academically and not letting their well-being be a barrier to their success here at the University of St. Thomas. So whether something presents physically, like a broken ankle, mentally, like depression or anxiety, spiritually or academically, we really want to make sure all of those different pieces of well-being are in harmony and people are focused. Students are learning here how to manage their well-being and have a successful academic career, because our mission is to help educate students on how to be well and continue being well throughout their career and lives. So what does that mean for us? ACHA, which is the American College Health Association, does a survey for students and asks them, if you failed a test, failed a class, or struggled in your class, what were the factors that led to you failing? So I wanted to ask the crowd, this is a little bit interactive. We've all maybe had some struggles or seen our students struggle. What are some of the factors you think lead to students not succeeding in the classroom? Time management. Okay, great. And that's one where we want to peel the onion. What leads to poor time management for a student? What could be some of the factors that lead to a student not managing their time well? Procrastination. Absolutely. Again, what leads to procrastination in a student? Distractions. Yep. Inability to focus. Great one. Again, for us, when we keep peeling the onion, it usually comes down to something around well-being. Why is the student not able to focus? Question, why do you think students aren't able to focus on their classes? Pressure, overwhelming. Priorities, stress. Yep, could be something like sleep, right? There's a bunch of reasons. So let's look at what the ACHA told us students report being the reasons that they don't succeed. Ding, 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 procrastination, right? That was a great answer. But you can see that they're able to select more than one, and there's usually another factor that leads to this procrastination. Stress, anxiety, sleep difficulties, depression. At the root of most of these problems for students succeeding, and we can see this in the data, in terms of students that withdraw, the number one reason is a health-related concern. So we really believe that we need to focus on the student well-being to make sure that they succeed. And it's right there in the data. Any questions on any of these factors? So let's talk about us a little bit. We have something called the Center for Wellbeing here. So that's an integrated college health program. Just like we believe health itself is integrated across all those different dimensions, physical, spiritual, emotional, we believe that by integrating our services, we're better able to care for the whole person and help them in their academic journey, help them learn how to take care of themselves and focus on prevention. A couple of cool pictures here. We have a wellness 5K every fall that encourages students to start an active lifestyle, because that physical well-being will give them energy, will help them focus, help them have a balanced life. We do all kinds of great activities like yoga on the lawn, mindfulness, deep breathing exercises, teaching students techniques to reduce stress and anxiety so that they can focus successfully in the classroom. We have all kinds of programs with peer health educators, students who are learning about healthy activities and living, and then teaching other students, because the best way to learn is to teach. Also providing social well-being, a way for them to connect with other students and to connect in the community, building a web for success. So you'll see us, the students will see us all around campus. We do all kinds of services, all focused on holistic well-being. Where are we? Who here knows where the arches are? That's it? 3 or 4 people? All right, when you go out to the quad, look for the arches on the south side. That's a really big landmark here at the University of St. Thomas, and it's kind of a symbol that's used for the students' journey. All the freshmen have a ceremony where they march into the arches to begin their journey here, and then once they graduate, there's a big celebration where the students march out of the arches. So when you're at the arches looking south from the quad, we're only 200 steps south in between North and South Campus. There's a street called South Finn Street. If you're looking out from the arches, hey, actually look in this room, they're right there. They're the arches. So if you just look a little bit to the right on South Finn Street, we have a comprehensive well-being center that has all of these services in one roof, under one roof. So I'm going to talk about the 3 partner areas that we have in the Center for Wellbeing, and beyond that, how we partner with the University for Wellbeing outside of the walls of the Center for Wellbeing. I'm going to start with counseling and psychological services. I'm assuming by now you've all seen Deb's presentations on parent transitions. Awesome. Okay, so she is the director of counseling at CAPS at the Center for Wellbeing, and that's where the students can come and get individual counseling, group counseling, psychoeducation, and many other resources around mental health. Your student is paying a health fee, and all of that is covered under the health fee. And so you, as parents, are our #1 partner for these students. Who do students call when they're stressed out, when they need advice? It's going to be you. And you're going to remember, oh, this guy Luis gave a presentation and said if my student is having some type of well-being issue, they should call the center. So really consider letting your student know about our services and helping get them here if they need help. Particularly counseling and psychological services, completely covered by the health fee that they're paying each semester. I'm going to flip over all the way to the left and talk about health promotion, resilience, and violence prevention. So that's the group that, when I was talking about peer health education and all the outreach events that we do, that's the group focused on prevention, healthy practices, well-being in the promotional space. I have a little cheat sheet because they do so many things out of there. We have wellness coaching that comes out of there, another foot in the door for well-being. Some people feel, unfortunately, there's a stigma behind counseling, so they feel more comfortable starting with a wellness coach targeted on something like sleep, nutrition, relationships. And once they build that trust, either they take care of the issue with the wellness coach, or it can be an internal pathway towards counseling. So they have healthy relationships, stress management. We do a lot of sexual violence prevention training in the community for students and staff and faculty. Bystander interventions, alcohol and drug education comes out of that group, and then proper sleep and other kind of topics for well-being. Again, all the services there, yoga for resilience, meditation, deep breathing, wellness coaching, it's all part of the health fee. So students should really use these resources and maintain and promote their own health. Last section I want to cover here in the middle is health services. We have a full primary care clinic here right on campus. We have a medical director, we have advanced nurse practitioners, we have registered nurses, we have psychiatry, we have a psych nurse practitioner, we have physical therapy available, we have a nutritionist. Any kind of illness, treatment, and diagnosis you'd see in a community primary care clinic, we can do here. So I really encourage you to think about your students. Let's say they have a broken ankle, let's say they have a chronic disease they need help managing, medication management, we can do it at health services. We do bill insurance through health services, but we make sure to make our services very affordable and accessible. If there's any insurance issues, we have a billing specialist to help work through that. The advantage of having all of these in one area is that there's no wrong door for well-being. In other colleges, you'll see these services at different parts of campus. A student could come in here, they recommend going to the clinic. There's a barrier there, there's a referral required. Here, just go to the front desk, schedule your next appointment. So keep us in mind for your students' well-being, again, as one of our most important partners. I do want to tell you a little story. This journey for the University of St. Thomas started in 2019. We developed this wonderful program. We talked about integrating our services. We got the champagne bottle, broke it on the center once we opened, February 2020. So what happened right after that? COVID. So after that, the COVID pandemic started, our roles in all of these areas changed significantly. But I'm proud to say that we continue to support the well-being of our community and have enhanced our services to address the ongoing needs of COVID. In counseling and psychological services, 2 things I want to cover. 1, up to 50% of our appointments right now are telehealth. That allows for students who are either presenting with symptoms or for whatever reason aren't comfortable in a room with a counselor or in group counseling to continue their mental health care. In addition to that, the acuity of mental health, meaning the presentations for this generation, and for all of us, frankly, are much higher right now. We're seeing higher levels of stress, anxiety, depression as we navigate this world and the stress that the pandemic's put on all of us. So we're seeing a higher demand for mental health services in our group. So those 2, counseling has increased its capacity to help people and changed its model to make sure that we reach people. For health promotion, resilience, and violence prevention, we've done a lot of online programs as well for kind of deep breathing exercises. People can join Zoom meetings, yoga, etc. Another operation that comes out of there is contact tracing. Raise your hand if you know what contact tracing is. Yep. So for your students who, if they're in the residence halls, they get a positive test, they're informed their roommate got a positive test, they were at a party where someone was positive, they can call our COVID care management team They'll talk them through what their specific needs are based on when they were exposed, when they should test, if they need quarantine or isolation. All that comes out of our health promotion group now. So health services also had to change radically to address the pandemic. So we have COVID testing available on site. We have a Monday through Friday triage line with a nurse who can speak with students who have upper respiratory symptoms or have been exposed as well to understand when they need to test, what's the best test they could take, scheduling them for a test. And we have vaccinations available at health services now, so we rolled those out for boosters or first-time vaccinations. The last thing I want to cover that the center is responsible for is that the university made a decision to have a COVID vaccination mandate, and that flows through our systems because we have a health record that's synced with the Minnesota immunization registry. So if your student was immunized in Minnesota, it's likely we will have that record and that they will be in compliance. Don't worry if not. If we don't have the information, your student will get an email with instructions on how to be compliant. There's one of three ways that they can be compliant. One, upload their vaccination card. Two, of the mRNA series, or one of Johnson & Johnson. Two is a religious exemption that is notarized. Or three is a medical exemption that's signed by a provider. So just let your student know. Keep an eye out on their emails. They will get plenty of notifications, multiple notifications if they're not in compliance, and that we will help them get that information. Something you need to know about your students now that they're adults, we're HIPAA compliant, so we cannot share medical information. It's all confidential with you since they're adults. If there is an emergency, the university will contact you about that from the level of the dean of students. But if we have medical information related to that emergency, we can't share that with parents without a release of information. So that's kind of a summary of our services across the three partner areas. Again, might want to take a photo of this or write that down. This is our number, just one number. All those services flow through one integrated center. And we'll work with our partners across campus too. So well-being extends beyond mental, physical, spiritual, emotional. It could be academic well-being. It could be financial well-being. Any kind of challenge in one of those areas affects the whole person, and we'll work with the campus resources to make sure that they're getting the care they need. You might see that health hut out around campus. Students certainly will throughout the year. It's just a plug for the fact that we do have peer health educators, undergraduate students, who are learning about health promotion and then teaching some of these healthy practices. If your student's interested in a career in healthcare or something related to health, it's a great way to get a job here and then learn. So, a lot of information. I know it's 2 o'clock in the afternoon and you have a few more. Do you have any questions for me? In the back? Yep. MDH and CDC are aligned. But we followed the MDH and CDC guidelines for contact tracing and for when to test and exposure, et cetera. Yep, good question.
How do we get the form to sign for the release of information form?
That your student would need to get it once. So access to the Center for Wellbeing will start after the student's registered and they're active. And they'll be able to go on My Health portal, or they can just call the number and request a release of information. And the student would have to sign the release of information and then upload it into the portal if you wanted to have access to any of their protected medical information. Yep.
Does the health service have prescription medication, or is it just like you go in and you have an infection, you have their own pharmacy, or is it?
We don't have a pharmacy on site. We do carry some over-the-counter medications, but we partner closely with regional pharmacies. Just being in the cities, there's pharmacies all around the school within walking distance. For some of them, we can deliver to the center, but we work closely with them to make sure. So we do medication management. That's another advantage of having an integrated center. Let's say you need mental health medication. You can have your appointment with your counselor right after, go to one of our prescribing providers to have the mental health support there. And we have a psychiatrist if you need advanced specialized care. But all kinds of medication for any kind of ongoing medication management we can do.
So like with allergy shots, you would hook up with them and
Yep.
keep the medication there?
We do allergy shots. Our registered nurses can do allergy shots. So that's a service we provide. Mm-hmm. Also, tell your student to keep an eye out for when we do our flu clinics. We host flu clinics every fall. That's a good chance for them to get up to date on their vaccinations. Any other questions? All right, well, thank you for listening. Remember, I just want to leave you with that you are one of our #1 partners. I promise you over the next 4 years, your student's going to have a breakup, they're going to be stressed about something, they're going to have some reason to call you. I don't know what that reason's going to be, but you're going to say, oh yeah, Luis told me about the Center for Wellbeing. Why don't you give them a call? So thank you very much for being our partner.
Thank you.
I don't think this would probably apply to everyone, but
Yeah.